Hi friends, this is Dr. Pooja and our today's topic is muscles of mastication. So let's study about this. First, let's go to the definition of muscle and mastication. Muscle is a bundle of fibrous tissue in a human that has the ability to contract, producing movement in or maintaining the position of parts of the body. Mastication, it is a complex activity aimed at breaking down and insalivation of food preparatory to swallow. Let's move on to the masticatory muscles. Friends, there are 4 masticatory muscles: Masseter, Temporalis, Lateral and Medial pterygoid. In this whole video, we're gonna study about origin, insertion, nerve supply and actions of each muscle in detail. So this is my notes, friends. Going deep with this masseter muscle. Friends, masseter muscle is a quadrilateral in shape, which has a superficial head and a deep head, originating from anterior 2/3 of the zygomatic arch, stressing it again, zygomatic arch, and inserting into the lateral aspect of the ramus of mandible. Moving ahead with the temporalis muscle. It is a fan shaped muscle. I am showing it in the diagram clearly. It's a fan shaped muscle originating from the temporal fossa, stressing it again, temporal fossa and the temporal fascia. When things come to temporal fascia, we have investing layer of deep cervical fascia in which has skin, superficial fascia, deep fascia, in which temporal fascia is one among them. So its origin is from temporal fascia and the temporal fossa, which inserts into the pterygoid fovea on the anterior neck. Pterygoid fovea is roughly here, situated here, and anterior margin of the articular disc, which I will show you in the upcoming figures. Roughly, you remember, articular disc is somewhere situated here in between the temporomandibular joint. This is a temporal and the temporomandibular joint. Let's moving ahead with the lateral pterygoid muscle. So this is a lateral pterygoid muscle, which is short and conical shaped, has a upper and the lower head. Its origin is from infratemporal surface and the crest of greater wing of sphenoid bone, and the lower head is from the lateral surface of lateral pterygoid. Lateral surface of lateral pterygoid is a lower head. Then its insertion is into the condylar process here, then anterior border of the ramus of mandible, then the margin of a articular disc, the anterior margin of articular disc. Then next, moving ahead with the medial pterygoid muscle. Even it has 2 heads, that is a superficial head and a deep head, originating from maxillary tuberosity. Here you can see in the very bony prominence, it is behind the 3rd molar, you can see a bony prominence, that is a maxillary tuberosity origin. Then insertion is the medial aspect, medial aspect of the mandibular, behind the mandibular foramen and the mylohyoid groove. Mandibular foramen and the mylohyoid groove. Next, moving ahead with the nerve supply. Nerve supply to all the muscles of mastication is by mandibular nerve. To the masseter is by masseteric branch of the anterior division of mandibular nerve. To the temporalis is by temporal division of the mandibular nerve. Lateral pterygoid is again the mandibular nerve. Medial pterygoid is by main trunk of mandibular nerve. Next, moving ahead with the actions, that is depression of mandible, that is opening of mouth, is lateral pterygoid, is by lateral pterygoid. Then elevation of mandible to close the mouth is by Masseter, temporalis and medial pterygoid. Protrusion, forward movement of mandible, is by Masseter and lateral and medial pterygoid. Retraction, backward movement. Posterior fibers of temporalis muscle. Lateral movements, that is side to side movements, is by temporalis, lateral plus medial pterygoid. Here is again the same diagram depicting the same: protrusion, retraction, elevation, depression and side to side movements. So guys, this was all about muscles of mastication. For any queries, you can reach to the given email ID onto the screen, and mainly it can be asked as a short essay or a long essay in examination. Please like, comment and subscribe to my YouTube channel to get the latest updates. See you in my next video. Take care.